Hi, my name is Alyssa Everett. I am doing my presentation on physical therapy as a non-opioid treatment in the management of chronic pain. This particular material is meant for the elderly people above the age of 50 years old in the effort to educate them on the usefulness of physical exercise in managing pain. Most individuals within this age bracket often experience pain in their body tissues as a result of muscle loss and strength. Until recently, opioid medications were intensively used among patients with chronic pains. But due to addiction tendencies, the public health system hindered the massive production and distribution of these drugs. My goal in teaching for this presentation is that by the end of this presentation, patients suffering from chronic pain will recognize the effectiveness of physical therapy along with pain management. Some specific objectives I have: cognitively, patients will identify a minimum of 2 benefits associated with physical therapy as pain management treatment. Along with, patients will identify a minimum of 3 forms of physical interventions that suits one's medical condition. Patients will later decide if physical therapy is a useful alternative to effective pain control. Effective would be patients will be issued with a handout with relative information on physical therapy. Patients will be requested to ask any questions concerning physical therapy, along with allowing them to explain some of the hindrance that they may limit them in the effective use of physical therapy and pain management. Some other specific evaluation techniques for this presentation: cognitively, it'll be effective learning will take place when the patients will be able to recognize advantages associated with physical therapy. The patient can mention and explain the importance of various forms of physical therapy and interventions. The patient will also be able to match their health condition with a suitable form of physical therapy. To determine if effective evaluation techniques have been effective, effective learning will have taken place if patients can distinctively will be able to distinctively identify the barriers that might prevent the utilization of physical therapy in pain management. Also, if patients can ask questions relative to the physical therapy without diverting from the topic. Excuse me. In regards to my handout, I have my handout right here, and as you can see, it is chronic pain management, opioids and pain management. Did you know opioids is harmful to one's health? Opioids include morphine, hydrocodone, oxycodone, and other drugs. Opioids lead to side effects such as addiction, vomiting, sedation, dizziness, along with constipation, which then requires increased exercise and fluids, along with laxatives. It can cause the nausea and vomiting, especially with increased age. There's also a tolerance that can develop with antiemetic therapy, along with urinary retention. Some will also have side effects such as dry mouth, bad dreams, even seizures, or respiratory depression. Some will suffer from night sweats, sedation, slow or irregular breathing patterns. Moving forward, physical therapy. Did you know that physical therapy can be used to reduce pain instead of opioids? Did you know the following actions result from physical therapy? You can use jogging, running, swimming, massage, along with yoga, Pilates, spin classes, water aerobics. All of these reduce physical impairments, cartilage, soft tissue damage, along with decreasing back pains, headaches, joint pains, and also it can also decrease diabetes. It's recommended to do 30 minutes 3 to 5 times a week. This is a great recommendation to help decrease the use of opioids. That could be just brisk walking, along with any of the other topics that I had mentioned. Some other great alternatives to physical therapy as well can be manual therapy, along with hydrotherapy, massage. All of these have been dated back for hundreds of years and are highly recommended. Moving forward, pros and cons of physical therapy. Some of the pros: it can promote body well-being, it reduces exposure to chronic diseases. It can also be done in groups, so it's a great way to get family members that are already suffering from pain management issues to help you work as a team, really team building, family bonding, and it's a great way to really help them reduce their use of opioids while finding better alternatives. It can also reduce obesity, which is a great thing, and a lot of our country suffers from it right now, and it's a great implement to help reduce that as well. Things to be considered upon. Physical therapy can lead to injuries. Time consuming, it can increase the pain, and depending on the condition. When you're considering physical therapy, overdoing it definitely needs to be a consideration. Just because you think this is what I'm doing, this is how I can do it, you really need to limit yourself to what you're actually physically and mentally able to accomplish. Along with how you're performing your stretches and positioning is a very key component to make sure you're correctly doing them properly and using proper body alignment, because you can actually be at risk for further injuries. Also, knowing sometimes that when you're doing physical therapy, you might actually decrease because your body is not used to this, so it might get a little bit worse before it can actually get better. And before you start any form of physical therapy, always speak with a physician. Make sure that you are adequate enough to be able to do the physical therapy, and if you're not, what alternatives they would recommend for you. Moving forward, target audience for the physical therapy. Did you know that physical therapy is helpful for elders, youth, and children? I feel personally that physical therapy is great for anybody, any age, any group of people, ethnicity, anything. It's always good to get out there, get your body moving, stretching, realigning, finding your focus, really finding your inner chi, and really helping to improve your total physical and mental health. As you can see here are some of the links where you can find the information as well. The opioid pandemic has caused significant adverse effects in our community. Based on the fact that opioid medications are extensively used in effective management of chronic pain, efforts to mitigate is useful in society has proven to be somewhat difficult. This is because both the government and medical institutions feel that there is a need to have medications accessible to individuals in the community, but to only be prescribed under certain circumstances. According to a recent article published in the New York Times, authors Gee, 2019, highlighted the negative impacts the opioid epidemic has on the community, particularly among healthcare institutions. As the war against opioid continues in the United States and other countries across the globe, a majority of medical facilities have been under pressure as the exercise has caused massive resource utilization of medical resources. Based on the article dubbed "Don't Forget Our Frontline Caregivers in the Opioid Epidemic," many hospitals continue to suffer in terms of finances, manpower, and facilities as the wage war against opioids addiction in our community. In the article, the authors commenced by comparing the opioids crisis to some of the diseases that once paralyzed Americans' public health systems, such as typhoid, AIDS, polio, and the Spanish flu. Besides, it gives troubling statistics on the number of demise that have been caused by opioid overdose over the last decade. From 1999 to 2017, approximately 218,000 individuals in America met the unfortunate death as a result of opioids-induced overdoses. Also 2019. Besides, among the 70,000 recorded drug-related deaths in 2017, almost two-thirds of the fatalities were related to opioid overdoses. This suggests that in a day, approximately 130 deaths occur as a result of opioids used in the community. Based on these statistics, the authors note that a majority of the country's medical institutions like hospitals and the overall healthcare system have been disabled by the overwhelming demand to provide an effective solution to the drug problem, while ensuring addicts get the much needed medical attention they deserve. It is projected that over $216 billion has been used within the pharmaceutical sector to manage the opioid crisis since 2001. This, however, has not helped the country much in effectively mitigating the adverse effects the drugs have in our society. The opioid crisis has caused significant changes in our institution and society. According to this article, in the past, the state reacted to healthcare issues such as smoking with massive lawsuits, which resulted in accumulation of $246 billion as a settlement from tobacco companies. This, however, is not the case with the opioid crisis, as both the government and members of the public seek compensation from the distributors and manufacturers of the drug. It is alleged that the producers and marketers of the opioid drug misrepresented the adverse long-term effects the drugs have on individuals and society as a whole. Also, the distributors are accused of not effectively controlling the use of opioids among chronic pain patients, causing over-dependence on the drugs among victims. A majority of these lawsuits have been placed under the National Prescription Opioid Litigation in the Government Law Court within Cleveland. Also, the lawsuits are meant to seek compensation for the cost incurred by hospitals in the efforts to mitigate the opioid crisis. Most individuals are addicted to opioids seek medical attention from the emergency room. This has increased the demand for ER services across the country. More patients continue to access ER services because of the high costs associated with other medical services, which many people cannot readily afford. However, this causes a lot of other problems since some patients require intensive long-term care, which the ER does not offer. Besides the lack of medical covers among a majority of the addicts causes most hospitals to suffer substantial financial costs as they provide healthcare services at low or no cost at some patients. To conclude, the article suggests that the establishment of lawsuits against the producers and distributors of the opioid drug will help raise insufficient funds, and that will help the effective mitigation of the ongoing epidemic. Physical exercise and pain management. With the adverse effects the opioids have among the patients with chronic pain, both the government and the public health department have established strict policies aimed in hindering the production and distribution of these drugs. This has a significant effect on the healthcare system since both parties in healthcare have resorted to other treatment methods and can help manage pain effectively. One of the most practical treatment methods have been embraced by a majority of medical institutions is utilization of physical therapy. Ambrose Golady, 2015. Based on the fact that most patients with chronic pain struggle with bodily movements, the inclusion of physical therapy and exercises in the daily routine can help reduce tension in stressful areas, providing relief without the use of any medications. The utilization of non-opioid therapy in the management of chronic pain is the best cost-effective and beneficial to the patient. The Centers for Disease Control Center Prevention recently established a policy advocates for the use of non-opioid treatments in chronic pain management. This has led to the establishment of strategies aimed at promoting the quality of patients' lives and reducing the use of medications in society. Many patients who use opioids do so as many means as pain control, but unfortunately some of the advanced tendencies of addiction to the drug resulting in it not serving its primary purpose. For the public health department to associate that the use of the opioids is effective mitigation, medical practitioners have to ensure the smooth transition from the medications to other treatments among patients. This may be difficult based on the fact that some patients have become addicted to the drugs, and deny them access to the medications might result in unexpected demise. It is the reason that medical institutions need to have chronic pain specialists located in the hospital to help chronic pain patients decide on alternative treatment process such as physical therapy. The main idea behind the establishment of physical therapy exercise as a useful medical intervention in the management of chronic pain is to enhance the quality of life of patients, and they learn how to control the pain by staying physically fit. Physical therapy can prove to be difficult for some patients since it involves intense muscle movements that can be strenuous to some patients. However, though the help of licensed physical therapies, patients can learn what exercises are better and can work depending on the individual's health status. Physical therapy entails activities such as walking, running, swimming, massage, and lifting weights. Though the incorporation of these activities in the patient's daily schedule, one is prone to manage pain and to conduct a healthy lifestyle effectively. Besides this treatment process, this does not require a lot of money to the facility. It thus allows patients to minimize the stress associated with medical bills and frequent hospital visits and the healthcare practitioners. Overall, I feel that physical therapy is a wonderful source for anybody, especially people that are dealing with chronic pain and that use a lot of different forms of pain management. It's a great way to really start to decrease and wean yourself off of pain management, because if you can really pull yourself off these horrible pain medications, it not only will help the epidemic, it will help the person individually, and they will have a better self-awareness, decreased side effects, and a total overall well-being. Thank you for listening to my presentation, and have a wonderful day.